Alright team, so in this video we're going to be talking about muscles in the arm. So the upper arm, as well as we're going to talk about a couple that are in the forearm. But for these muscles, when we're looking at them in the cat, we're actually looking more at the kind of, if our cat in anatomical position, we're looking more at the muscles that would be like in this area, as well as a few that are going to be on this anterior surface that are going to affect the motion in the palms. We're not going to look so much at the posterior side of some of these forearm muscles because they're just really hard to get out and look at. But we are going to be looking at some of the deeper and larger muscles in here because they are required for a lot of our range of motion that we'll see in our arms. So for these, there are a few that we're going to look at that are in the human that you need to know that aren't in the cat. The first one is the brachialis muscle. This muscle has an anterior distal surface of the humerus origin, so it's going to be like right on the kind of front part of your humerus here on the side too, going around. And it's going to insert on the ulnar tuberosity. So it's going to be kind of on the side of the ulna. Again, when we're thinking about the ulna, again, you're thinking about the muscle that's on this side, pinky side. That's going to be your ulna, your radius being thumb side. So it goes around. So it's going to be like on the inner side here, going through. And so its main job is to allow for flexion of the elbow. One of the things you'll see with a lot of these actions for the arm muscles is that, like, if you put flexion of the elbow, like 95% of the time you'll be correct in terms of its overall ability to do motion. That is what most of these are allowing you to do, flexion and extension at the elbow. A muscle that we're only going to see in the cat, and the only reason we're looking at it is because we're going to cut it away, is this thin layer of muscle that's called the epitrochlearis. In humans, we have a muscle that's like sort of this, but not this, has a different origin and insertion, but a similar function. But with the epitrochlearis, we're going to see it's this like layer of muscle that's going to cover part of the arm here, that we're going to cut this away so we can see parts of the triceps and part of the biceps brachii. So for the epitrochlearis, it's going to originate on the lateral surface of the ventral border of the latissimus dorsi. It's actually a muscle that originates from another muscle. Some argue that it's actually just a continuation of the latissimus dorsi. I don't totally believe that. But then the insertion of that is going to be on the aponeuroses of the forearm fascia. So essentially it's going to like just insert into this fascia around your elbow in the cat. So we'll be just doing a mid-sagittal cut of this muscle, cutting right down the center of it, so that we can then flip it over to see the deeper muscles that are going to be in there. And again, its main job, if it's going to do anything, is help extend at the elbow. All right, so big arm muscles, the ones that you see all the people doing like all of the arm lifts and stuff to like work them out, all that things, are your triceps. So the triceps brachii, like tri referring to three, sep coming from the root for like head, so it means like a three-headed muscle. So triceps brachii is a three-headed muscle on your arm. So that brachii refers to arm. And so for the tricep brachii, there are three different parts of it, three different sections that we define: the lateral head, the medial head, and the long head of the muscle. And so for all of these, they have similar origins, insertions, and actions. One of the differences between them is actually are innervated by different nerves. They're not all the same nerve that fires. But these work mainly with extension of the elbow. Okay? So that's their job. So like your biceps brachii really does the flexion. Your triceps brachii, when they contract, pull your arm open and allow you to extend it at that hinge joint of your elbow. So the triceps, they originate on the superior, posterior, and lateral margins of the humerus. So they're going to begin like on all of these portions of the humerus here. Okay? But your triceps brachii long head is actually going to originate on the border of the scapula here, so on this lateral border of the scapula. And they're going to insert onto the olecranon process of your ulna. So again, on the backside of your ulna here, this is where all of those triceps are going to insert on this area. Okay? And again, extension of the elbow is its main action. So again, with the triceps brachii long head, again, same origin, insertion, and action as before. You just need to be able to identify that it's in a different location. That's a different part. So for the long head, you remember this one because it's the long one. And it's going to be the one that's going to go from your scapula, and again, be more like towards the center of the body, as opposed to their lateral head and your medial head. They're going to be more in the middle and on the lateral side, so the outside of it. And then your medial head, again, going to be running down the middle of this on the posterior side. It's not going to, it's like in the middle in terms of length, in the middle in terms of location. It's the middle one. All right, so again, all of these different parts of your triceps allow for you to extend at the elbow. So they pull on the lower portion of your arm to allow you to bring out your arm. Another muscle that we'll look at is the brachioradialis. So brachio referring to arm, radialis referring to your radius. So the brachioradialis is actually going to be a muscle that's on this area in this joint, like where your elbow is, that's going to allow for kind of that additional flexion of the elbow and stability. So if you look at it, your brachioradialis is actually going to be more on the side of your thumb. So it's going to be like over here in this area. You can actually feel it if you are flexing at the elbow. This part of the muscle moving. Again, as you feel more to like the lateral side of your arm. Okay? And it's going to go all the way and it's going to insert onto the styloid process of the radius. So the muscle up here, but it has a really long tendon that runs the entire length down to the styloid process here on your radius. So it goes this entire length here. So the brachioradialis, again, flexion at the elbow, pretty tiny muscle when we look at it in the cats, but it's really important when it helps and assists with that flexion. It allows you to bring the arm in all the way. Another muscle that's responsible for flexion at the elbow is your biceps brachii. The biceps brachii, like your tricep, by referring to two, ceps being head, so this is a two-headed muscle. And for this one, we have the long head of the bicep and the short head of the bicep. So the long and short head of the biceps are both going to originate on the that bone, on the scapula, and they're going to go down all the way to the front part of the tuberosity of the humerus, so and the ulna and the radius. They're going to actually go all the way around to the radial tuberosity, and they're going to go down to the go down to this aponeurosis. There's a layer of connective tissue that supports here that your biceps kind of meld into to provide again that support as you're doing your flexion. So with that, the short head of that muscle is going to start in the coracoid process, and the long head is going to be in the supraglenoidal tubercle. This is a tubercle that is kind of an additional part kind of underneath your scapula. But again, just know that it's like in that area where you have that socket, your glenoid fossa. It's going to be an area that's inside of that part that's going to attach. And so that's going to then go the entire length of your arm here, and then it's going to pull on your radius and allow for flexion. So it's going to allow you to bring these together. Okay. We also say that it helps with flexion at the shoulder because if you contract it and turn it, it does help you raise your arm up this way as you're flexing. So like you're doing the Rosie the Riveter pose kind of thing. Right? It also does support with supination. So remember when we were talking about motion, this is a special type that just deals with the rotation in your arm. But if you're supine, it's allowing you to stay in anatomical position versus if you're prone, where you're bringing your palm facing upward, or sorry, facing downward as opposed to in the back of your hand upward, as opposed to supine, where your hands are together and you can like hold the feet. Right, so with the biceps brachii, when we're looking at that, in the cat, it just looks like one muscle. It's really hard to discern the two heads of the muscle. In humans, it's much more apparent. There is a very drastic difference between the two. Our next muscle that's here is the pronator teres. So the biceps brachii helped with the action of supination. Well, there needs to be something that allows you to then pronate your hand and rotate it. So you're going from this to this, right? And your forearm to do that. And that's your pronator teres. So your pronator teres actually goes around the elbow joint. So it starts on the medial epicondyle of your humerus, kind of like on this far part right here on the outside, and actually goes across to, from that point over to like the backside of your ulna to allow you to rotate it around. So it's like going up and around over here to allow for that rotation to bring you in. And again, its main job is to help support with pronation. So again, it's pronator teres. Its action is to pronate across. All right, palmaris longus. So this is a muscle that is pretty, I think, really fascinating. It's one of those muscles that we'll see in the cat. It's pretty large because it's the main muscle that cats use to like claw down on stuff. So they need to have that strength to make sure that that happens. But if you dissect humans, there's like a 15% chance that you'll have a person that will not have this muscle as part of their actual structure. Like for example, if I'm ever up for a dissection and using my body for science, they will not find this muscle in me. I do not have it because I do not have the tendon that's directly linked to it. So with the palmaris longus, it's a muscle that allows for essentially flexion at the wrist and helps anchor the skin, but also can help support with the actual flexion at all of your fingers. So it actually allows you to provide additional support and strength in this area. So the palmaris longus, when we look at it in the cat, is going to be much more apparent, kind of running down this center part of the arm. In humans, it runs more on the pinky side here, and you can see it kind of running in this area down. And you can test for that by looking for the tendons in your wrists, and I can show you how to do. I'll show you how to do that in class. But again, for this particular muscle, it's not one that everyone has. But we will see it in the cat, and it's a pretty large one in that specimen. All right, so that's it for the arm muscles. If you have questions on those, let me know.